Okay, so we're going to get started, and I'm really excited to introduce our first presenter of the day. Dr. Siobhan O'Neill and I met several years ago, and I was just immediately inspired by her depth of practice and her integrative approach to medicine in the field of psychiatry. And so we're excited to have her here today. Siobhan O'Neill is a part-time assistant professor of psychiatry at Harvard Medical School and co-founder of Mindframe Consulting. She's a graduate of Harvard Medical School's residency in psychiatry at Massachusetts General Hospital, McLean Hospital, where she served as chief resident. She completed advanced training in psychoanalytic psychotherapy, group psychotherapy, spiritual psychology, and psychosynthesis. Dr. O'Neill is currently a student of the Insight Yoga Institute and a longtime meditation practitioner in the tradition of Thich Nhat Hanh. Dr. O'Neill has a clinical practice and consults to major medical malpractice insurers in New England. Since 2008, she has been facilitating peer resource and support groups for doctors and nurses. She teaches nationwide on navigating the aftermath of adverse events and on cultivating humanity and self-care in the practice of medicine. Please welcome Dr. Siobhan O'Neill. Thank you.
Thank you for that lovely introduction, Jen. Just going to get my timer out here to keep track of time. And thank you for the invitation to be with you here today. This is the first talk I've been able to give live in a couple of years, and it's really a privilege and a delight to be here. I also appreciate the great effort that many of you went to get here and the last-minute changes that needed to happen so that we were all able to be together in person. Also wanted to thank Jen for making this all happen, Bill Conaboy, Carmela Fox, Jim Brogna, and my co-presenter, Dr. Tracy Myers, and the other teachers from Studio B who are here, Sarah Jane Changra and Sid Mons. It's really a pleasure to be presenting together with you today. Oh, here we go. So I'm going to be speaking with you today about building connections within our own minds, brains, body, mind, heart systems, connections within organizations and among each other, how we can do this through the practice of mindfulness, and how when we do that, we build resilience. We build resilience within our own systems and within our organizations, teams, and groups. Before I do that, I wanted to just share with you a personal experience I had and how my own long-standing practice of mindfulness helped me. So at the beginning of the pandemic, I was on my way to an appointment and driving on the Mass Pike and got a call from an emergency room that my mother had been taken there and was diagnosed with COVID. And I knew that this also likely meant that my father would have COVID. So I changed my plans. I did not go to my appointment. I canceled that and instead made my way to Connecticut where my parents lived. On my way, I asked a friend to help me locate some N95 masks at a hardware store, made a stop there, got myself some N95 masks, and instead went to my father's place of residence in an assisted living. He was not taken to the emergency room because he was already quite frail and in hospice care. I was full of all kinds of emotions, as you might imagine: fear, grief. And so I arrived there, got out my N95 mask, located a face shield, found a gown, some gloves, got them on. And then I spent the next many hours sitting next to my father, navigating a whole sea of emotions. Again, fear and anxiety that I might get COVID, anger and rage because I knew my parents contracted COVID from their caregivers who were often not very careful about wearing their masks when taking care of my father. And then grief, knowing that this would be the last time I saw my father. Fear that my mother would also die of COVID, that I would lose both of my parents at the same time. These were overwhelming emotions, and I relied on my 20 years of practice in those hours. It was really hard. And I relied on my practice. I was so grateful to have my practice. My father did die a few days later. He was very, very sick. Thankfully, my mother survived. She was able to leave the hospital about a month later. But just a few days later, I had to rely on my practice again when I needed to go into the hospital to let my mother know that my father had died. And that was also really hard. So I wanted to let you know about this experience because my mindfulness practice was so powerfully helpful to me in these really difficult times. How? Well, through resilience. What is it? What is resilience? You surely all know a lot about it already. You wouldn't be here if you didn't already know a lot about it. I mean, none of us can practice in healthcare, in any of the jobs that you do, if you didn't already know a lot about it. But this is a more formal definition of what it is. What does it mean? It's a capacity to meet challenges as they arise. It's about adaptation and flexibility to changing circumstances. It's about our ability to return to equilibrium quickly after a stressful experience. And this can mean literally our bodily capacity to return to equilibrium. I mean, you probably are all familiar with the experience of, when you feel anxious or frightened about something, you can notice the bodily changes that occur. And how does it feel when your body starts to feel back to normal? How quickly does that occur? Does it take just a matter of minutes, or does it take hours? That is an experience of resilience. How quickly can we do that for ourselves? Most importantly, for the purposes of our conversation today, I want to point out that resilience is learnable and growable. We can learn how to do this even better. We can grow our capacity for resilience. And while you all know about resilience and you all have a great capacity for it already, we can grow our capacity further, and we need to continue to do this, particularly as our challenges grow, as they have certainly done in the pandemic. So we can think about resilience along different dimensions, or break it down into different dimensions. Physiologic, as I mentioned, our bodies experience stressors, and we can think about measuring resilience in terms of our bodies. And this is where practices like different mindfulness practices, but breathing practices, yoga, like Sid does and like Sarah Jane do. Emotional resilience, psychological, moral, interpersonal, and relational, and group and systemic resilience. So how well does a system, like your system of care, Allied Health, how well does a system respond to challenges like the challenge of the pandemic and the effect that it's had on your whole system? And why should we build resilience? It's probably obvious. Why should we? Well, we want to be thinking about it because resilience is very connected to well-being. It's a fundamental part of well-being. And well-being arises from integration within ourselves and within systems. Qualities of systems that are integrated are listed here. So a system that's well integrated possesses these qualities. They are flexible, adaptive, coherent, energized, and stable. And we can think of a system as, so ourselves as a system, our brains, our minds, but also, again, your organization and your system. And if you remember the definition I gave you of resilience earlier, you'll see there's a very significant overlap here. Flexibility, adaptability, stability. There's a very significant overlap. So if we're looking for well-being, a greater well-being, resilience is a very important, fundamental part of well-being. And what we know right now from all the data that are out there is healthcare professionals in all different fields of healthcare are not well. We are not experiencing a lot of well-being. This was actually true even before the pandemic, and the situation is even worse since the onset of the pandemic. So you've probably all heard the term burnout. You can't open a medical journal without reading an article about burnout. That was also true before the pandemic. Rates of burnout were as high as 50% among physicians and also quite high among nurses and other healthcare professionals before the onset of the pandemic. In 2021, that's the date of the number listed here, physicians report as high as 75% rates of burnout. So that was in 2021, well into the pandemic. Burnout is formally recognized by the World Health Organization as an occupational syndrome, so that means directly related to workplace circumstances. So it's not an individual problem or an individual issue. It's not a deficit or difficulty located within an individual. I think that's a really important concept to emphasize. People sometimes mistakenly believe that it's something about an individual, and therefore the solution must lie within the individual. But it's a systemic problem that's more frequently found in healthcare systems than in other occupations. And therefore, it's important, I think, that we understand the solutions need to be systemic and, again, not individual solutions, so that it's good that your organization is looking for some systemic solutions. And what is it? Burnout is a syndrome of three main things: energy depletion or emotional exhaustion, cynicism or depersonalization. That means starting to treat human beings as objects, not really as human beings, and decreased efficacy or decreased productivity in the workplace. So it has real effects on how people function in the workplace. And in healthcare in particular, it's been associated with increased medical errors, increased rates of malpractice lawsuits, and decreased patient satisfaction. So it actually has real economic impacts. And, in some of the literature on burnout, the implications of this are that if we really are to understand the impact of burnout on healthcare, we would really want to do something about it. It should really get our attention. And as if that isn't enough, it actually has serious health consequences for those who experience it. So for people who experience burnout, it increases health consequences for those individuals. So increased risk of hypertension, atrial flutter, cardiovascular disease, depression, suicide, and substance use disorders. We also know from the literature that physicians experience twice the rate of completed suicide than people in the general population. So that's not suicide attempts, but actually completed suicide. And nurses experience 1.25 rate of completed suicide of people in the general population. Again, those are staggering numbers and should really get our attention. We as healthcare professionals are not well. So what's happening when we're experiencing burnout? So generally, when we are functioning well, we are utilizing in our work that we do as healthcare professionals a lot of higher order brain functioning. So we have our cortex of our brain, which is where we do a lot of our complex thinking, and the prefrontal cortex located right behind here. We rely on it a lot to do the work that we do in taking care of patients. These are some of the complicated functions of our prefrontal cortex: higher order reasoning, social cognition, empathy, which we need a lot of to do the work that we do and to do it well, and also to function together in teams, to function well together in teams. We need to be able to maintain integrity despite challenges, to have insight about ourselves as well as others. We need to know how are people thinking and feeling to function well in teams and to take care of our patients well. We need to have emotional intelligence and the capacity to emotionally regulate, to be able to handle stress really well. So this is the function of our prefrontal cortex, and it's now been really clearly demonstrated that when we experience uncontrollable stress, which leads to the state of burnout, that these functions are impaired. So that's what's happening when people get into the state of burnout. So the very good news is that when the stress of burnout is relieved, that these functions can be restored. And the other very good news is that mindfulness practices actually enhance and support these very same prefrontal cortical functions. And that people who practice mindfulness regularly have much better functioning of these prefrontal cortical functions, and that these functions are protected and less likely to be impacted by stress. So how do we build resilience? You might then begin to notice the connection between mindfulness practices and the building of resilience. Resilience is about then strengthening innate capacities that all of us have, but we can do this with intention and through practices, but also through deliberately and intentionally moving toward and supporting things that we already do naturally as human beings, or making sure that we get our basic needs met. So if we think again about different dimensions of resilience, our basic physiologic needs, how do we get those met? We know that getting adequate sleep, exercise, and nutrition is fundamental, and that's a fundamental part of supporting our resilience. Oftentimes, though, we probably don't get enough of any of those. I mean, how many of you get enough sleep every single night of the week? Anyone? Does anyone get enough sleep? Show of hands. Who gets enough sleep every day? Nobody? There's not a single hand up in the room. Oh dear. Yes, so we could all do better with our sleep, apparently. Exercise and nutrition. Who gets enough exercise every day? Oh, 3 hands. That's great. But yeah, so exercise, also really fundamental to support our resilience. Nutrition, also really basic. Relationships, making sure that our social supports and our family relationships, friends, collegial relationships, that we're reaching out. Breathing and mindfulness practices also support our physiologic resilience. Emotional and psychological resilience. These are also supported by relationships, breathing, and mindfulness practices. In addition, there are other things here. We can support healthy expression of our emotions and regulation. There's education and seeking specific psychological support, like through psychotherapy or employee assistance programs. It's important to know what resources are available in your organization. If you have employee assistance programs, to know what's available in your organization. Do you have peer support groups? It's good to know what's available in your organization and to access those resources. And then there's the interpersonal and relational aspect of resilience. Again, seeking relationships, making sure that you access friendships and other supports, your team supports in the workplace, mentorship relationships. Do you have those? Do you seek them out? Do you foster them? nurturing relationships. And again, here, you also see that there are mindfulness practices and breathing practices. So what's common across all these three dimensions are relationships, breathing, and mindfulness practices. We're going to talk more about those. These are the three commonalities. So what is mindfulness? We're talking a lot about that today. So I wanted to give you two definitions. One that is, I think, one of the best ones that's out there in the literature, developed by John Kabat-Zinn years ago. He's one of the fathers of mindfulness research in Western medicine. And I think this is a beautiful definition that he came up with. The awareness that arises from paying attention on purpose in the present moment and non-judgmentally. Then here's another more recent one. In a mindful state of consciousness, attention and awareness are directed to the external environment as well as the internal responses to it in the present moment and with minimal interference. So there are subtle differences here, but I think a couple of important differences. One of them, in the second one, it draws attention to, you can pay attention to the external environment and your internal responses to it. So I wanted to pause here to give you an experience, a brief experience of mindfulness. We're going to practice this for a moment. So maybe get comfortable in your seats with your feet flat on the floor. You can sit up in your seats. And we're going to practice listening to 3 sounds of a bell. You can close your eyes if you're comfortable doing that, but you don't need to. But sometimes it helps people focus if their eyes are closed. It just minimizes distractions. And we're going to listen to 3 sounds of the bell. And your task will be to attend as closely as you can to the sound of the bell, following the sound until you can't hear it anymore, and then noticing your internal response to it. You will likely also notice that distractions arise in the moment, and then your task is to just return your attention to the sound of the bell non-judgmentally. And if distractions arise, just return your attention to the sound. And you can slowly open your eyes and then just notice what you notice. And that is the beginning of a simple practice. And how many of you noticed that you had thoughts and distractions arise in the course of your effort to pay attention, to direct your attention to the sound? How many noticed distraction? Yeah, most people. And that's part of the practice, just noticing that there's distraction and then returning your attention back to what you've decided, what you've chosen to pay attention to. And it's through this practice of choosing where to place our attention and returning our attention again and again that we build our capacity to direct our attention. And that's the essence of the practice.